Okay.
Hi, Dr. Rusty.
Hi, Gabby. How are you?
Hi. Good, thank you. Amazing. Thanks so much, everyone, for joining. So, the topic for our live this evening is embryo development. Before I jump into the questions, Dr. Rusty, could you please give a brief introduction on the topic?
Okay, yeah, thank you. So I will take you through what happens in the lab after doing egg collection and before you do embryo transfer or freezing of embryos. So essentially, so what happens is, let us say you do egg collection on Monday. So all the eggs are collected, and then if you do IVF, then eggs left with your partner's sperm in the incubator, and then next day embryologist checks how many of those eggs fertilized. If you're doing ICSI, then eggs are stripped off the surrounding cells, then sperm is injected. One sperm injected into each egg. Then next morning, which is day one, the embryologist checks for fertilization. So day zero is a day of egg collection, which is Monday. So Tuesday morning, embryologist checks, which is day one, for fertilization. So all the fertilized eggs are put in the incubator for further growth and maturation. So for the growth. So you have some unfertilized eggs and abnormal eggs. Those eggs will get discarded. So let us say you had the 12 eggs. So out of 12 eggs, 10 fertilized. Those 10 fertilized eggs, now they're called embryos. So they are put in the incubator to grow them for utilize until utilizable stage. So so on the day one, eggs have a one cell with a two pronucleus. Healthy fertilized eggs, they have a two pronucleus. This is called 2PN. They are actually called zygotes, not quite embryo yet, but they are in transition to become embryo. So one single cell with two nucleus. So then the next day, if embryo is developing fine, then that cell, one single cell, should divide into two, then divide again. So next morning, which is a Wednesday morning, which is day two, you should see 2 to 6 cell embryos. So then next morning, which is Thursday morning, which is day three, if you check, you should see approximately 8 cell embryos. So still, if you have a 6 to 10 cell, that's also normal, but generally in average, you should be seeing 8 cells. So these cells are copies of the main cell. So they just embryos keep multiplying. So cells keep dividing into two. Then you keep creating the copies of the cells. So let us say, okay, so you had the egg collection on Monday. You got the eggs and fertilized them. Next morning you checked. You have two nucleus, which is called 2PN. That's normal fertilization. All these normally fertilized embryos are put in the incubator. Then you check. If you check, you don't have to check. So next day there are 2 to 4 cells. Then next day 6 to 10 cells. So this day two and day three embryos called cleavage stage embryos. So here you can distinctly see each cell individually. So the next phase of development is called morula. So these eggs start compacting on day three. Then they start merging with each other to create morula stage embryo. So morula stage embryo, you cannot actually see each cell distinctly. So it all looks like mixed with each other. So that's day four embryo. So on day four, if you check the embryos, they should be morula stage embryo. So day three at night, they should be compacting morula. On day four, they should be full morula stage embryo. So then next day, which is so day five, which is a Saturday, so you should be seeing blastocyst stage embryo. So day one, so you have a one cell. Day two, you have 2 to 4 cells. Day three, 6 to 10 cells. For day four, morula stage. Day five, you should see blastocyst embryo. So blastocyst embryo has got two different cell lines. You have got surrounding cells. This is called trophoectoderm cells. Those cells become placenta. Then you have got inner cell mass. You have got a clump of cells inside the embryo. These are baby cells. These cells should become baby. So if you see a sac filled with fluid, and with the cells on the surface, trophectoderm, and inner cells inside. That's called blastocyst stage embryo. That's what we want before we transfer the embryos. So, and the blastocyst stage embryos can be in different stages of development. So let us say you have a 2-cell, 4-cell, 8-cell, then morula stage, which is day 4. Then you have a day 5. You can have a very early blastocyst, full blastocyst, expanded blastocyst, hatching blastocyst, and fully hatched blastocyst. So overall, we really want blastocyst embryos from early stage of blastocyst and fully hatched blastocyst. Fully hatched blastocyst is ready for implantation. This happens on day 5 or day 6. So these are the normal embryo developments. When everything is going well, the embryo should develop in this manner. So if embryos have some chromosome problems, if they're not healthy enough to become baby, then they can stop at any point of development, or they can degenerate. Degeneration means they start breaking down, or they just simply stop. Let us say after 4-cell, they just stop. They just run out of energy because their chromosomes are abnormal. They cannot multiply, and they can just stop at any point. So yes, in normal embryo development, so it takes approximately 5 days. Day 0 being day of egg collection, day 5 being the day of embryo transfer.
Thank you so much, Dr. Asti, for that introduction. My first question is, do you need to check the grade of the embryos every day?
No, you don't need to check the grade of embryos because it's not going to make any difference to those embryos. Actually, it's better if you do not interfere with embryo development. So generally, when we do IVF, our reference is natural conception. So what happens in natural conception, let us say you have ovulation, then if couple have an intercourse, then sperm travels to the fallopian tube and meets with the egg. So then fertilization happens in fallopian tube, which is a very dark environment, and with a low oxygen, dark environment. So, and the fertilization happens in fallopian tube, and this 5 day of development actually happens in fallopian tube. It takes 5 days for eggs to get fertilized, become 2-cell, 4-cell, 8-cell, morula, and blastocyst. Then it lands in the uterus on day 5. For 5 days, embryo develops until blastocyst in the fallopian tube, which is a dark environment and without any disturbance. But if you want to check the embryos unnecessarily, what you have to do is you need to take these embryos out, then expose them to the light and temperature change. That disturbs embryo development. So also you can check with a camera, continuous camera, but again, still it is exposure to the light. So essentially the best environment for the embryo is a single stage embryo development, which means you put the embryo in the incubator after checking the fertilization and do not disturb. You don't check. After 5 days, you open the incubator on day 5, and you should see blastocyst embryos. If embryos stop developing early on, that they would have stopped anyway, whether you check or not. No, you don't need to check. It doesn't add any information, any value to your treatment. So generally, it's recommended to do single stage embryo development without disturbing, without checking the embryos.
Thank you, Dr. Asti. My second question is, how can you tell if embryo development is normal?
Okay, so embryo development, so in human fertility is very wasteful process for good reason. That reason is to select healthy eggs and sperm and embryos. So which means a lot of eggs produced will not become high-grade embryos. A lot of produced embryos will not become baby. So because this selection should happen whether you do IVF or naturally. So IVF is a replication of natural fertility in very fast rate. So let us say in IVF, let us say if you have 12 eggs, 10 fertilized, now you got 10 embryos. You put those 10 embryos in the incubator, normally only 3 of them should become high-grade blastocyst embryos and should be utilizable embryos. It's very normal to lose 7 embryos on the way because naturally those embryos should have or can have chromosome errors. Usually it's originating from the egg, but it can originate from the sperm as well, so depending on sperm quality. So it's very normal to have 7 abnormal embryo out of 10. So same thing happens in natural conception. Let us say you have you release 1 egg every month. Across whole year you lose 12 eggs. Even if you get 10 fertilized, which means 2 of those eggs didn't fertilize, you have 10 fertilized. Out of 10 fertilized eggs across 10 months, only 3 of those embryos come to the uterus. And then 1 of those 3 should implant. So this is how you get natural pregnancies. You keep creating this kind of eggs and embryos. A lot of embryos stop developing because there's error. They never come to the uterus. Then embryos keep coming to the uterus, and 1 and 3 implants. So what happens in whole year of natural conception in couples without fertility problem will replicate in couples with infertility in 1 month generally. If they have good egg reserve, if they get 12 eggs, the same replication happens in the lab. So this is why if you get 3 embryos out of 10, that's normal embryo development. So we call this utilization rate. So utilization rate should be 30 to 50% in average. Or high-grade blastocyst embryo formation rate should be approximately 30%. The difference is utilization rate means you're getting any utilizable embryos, average grade or high grade. Grade 3, grade 1, grade 2 embryos, these are all utilizable embryos. Grade 4 embryos, non-utilizable embryos, you need to discard them. They don't have any chance to become a baby. So, but high-grade blastocyst embryo formation rate is the grade 1 and grade 2 embryos. Let us say out of 10, if you have 3 high-grade embryos, blastocyst embryos, that's normal. If you get 5, that's excellent. If you get more, even better, but 3 is normal. If you get 4 utilizable embryos, which means 2 high-grade, 2 average grade, that's also normal. So if your utilization and high-grade embryo formation rate is low, that means that's low, that you had a poor embryo development. You may get 1 embryo out of 10, that's very low utilization rate, or if you don't get any embryo, that's called failed embryo development. So that's not good. So if you have a very high utilization rate, let us say 7 out of 10 got to the utilizable state, that means that egg and sperm quality was really good, and egg maturation was really good. All this stimulation drugs really matched your receptors, and you had a very good quality embryos. That's excellent.
Thank you, Dr. Rusty. In your response there, you did touch on failed embryo development. Can you please explain how we can improve on that in future cycles?
Yes, in patients with a failed embryo development, we should really try and understand what is actual cause for failed embryo development. So for that, we need to look at the major parameters. So first, we look at the baseline fertility. So baseline fertility means, so each couple have got unique baseline fertility. So this is made up by major fertility factors. On female side, mainly female age and egg reserve, and overall health also, but mainly female age and egg reserve. And male side, sperm concentration, which is number of sperm, and quality of sperm, that's generally motility and morphology of the sperm. So you look at this baseline, and if they don't have any major issues on the baseline, and then you look at how many embryos they produced. So if they had a good number of embryos, let us say 8, 10 embryos, then if they had a failed embryo development, you should try and understand, is it because of primarily due to egg or primarily due to sperm? Both of them have a contribution, but generally egg has got more contribution. Generally 80% of contribution comes from the egg, generally, provided sperm quality is normal. If sperm quality is very poor, actually maybe sperm is negatively contributing to poor outcome more than egg. So then you look at the where embryos stop developing. If embryos stop developing very early on day 1, day 2, which means only in 1 cell or 2 cells or 3 cells or 8 cell stage, then very likely a lot of problem coming from the egg quality or egg maturation. Why? Because sperm becomes activated from the day 3, day 4. So first 3 days, embryos run on the genome of the egg. So egg provides with all the information, all the nutrition, all these conditions to grow and multiplication of the embryos first 3, 4 days. Sperm, until it gets activated, it takes few days. So if embryos were growing fine, when you look at on day 5, if embryos, all of them, like most of them, stopped on day 4, then it indicates the embryos were growing fine. As soon as sperm got DNA got activated on day 4, they stopped. So that indicates actually very likely there's a lot of contribution coming from the sperm. If embryos stop developing, most of them on day 5, then very likely it could be due to egg primarily again, or sperm. Why? Because when sperm got activated, embryo kept growing and become blastocysts, then they start degenerating or they stop developing. So that indicates probably it's mainly due to egg and possibly due to sperm. So this is not very clear cut because both egg and sperm plays important role in embryo development. So we need to take a look at the big picture. Egg is more responsible generally. Generally first few days eggs mainly responsible. So if embryos stop on day 4 in transition from morula to blastocyst, then it's very likely due to sperm factor playing an important role. Then if it stopped on day 5, it could be due to egg or sperm, but mainly due to egg. But this is in the very overall big picture. But in terms of individual embryos stopping development, we cannot tell. So it could be egg or sperm. So it's impossible to tell unless you do research and just track back to their chromosomes and understand where you had an error. Embryos stop developing generally if there is a chromosome error. So embryos should have a 46XX chromosome or a 46XY chromosome. If you have extra copies of chromosome or less copies of chromosome, generally these embryos are not fit to become baby and they stop developing early on. So, and this chromosome error mainly originates from egg, not in individual couples, not in individual embryos, but generally we are generalizing in the human population. Embryos usually stop developing due to eggs. So, but in individual couples, the contribution of sperm may be more, especially if sperm quality is poor and egg quality is good. So, but yeah, so let us say in 10 embryos, so overall we can tell and make an assumption. Yeah, so it's very important to understand. It's not exact science. Make an assumption and look. Let us say you had a failed embryo development. You had 10 embryos, none of them become utilizable. That's a very poor outcome. Then you need to try and understand, is it because you had a more problem in the sperm or more problem in the egg side? So looking at the when embryos stop developing on the baseline female age and egg reserve and the male sperm parameters, then you make an assumption. You can say it looks like primarily we had a problem with eggs. Is it because of egg maturation or egg quality? Looking at the chart, you can tell whether there was issue with the maturation or quality, or is it because of sperm? So usually we can give an estimate. So let us say out of 10, possibly 70% didn't develop because of eggs and 30% didn't develop because of sperm. So this is assumption of fertility specialists after reviewing whole cycle. So we do this during the cycle review and tell. But if you have a low number of embryos, not 10 embryos, let us say you have got 2 or 3 embryos, if they stop, if you don't get any high-grade embryos, it can be just due to chance because you're playing with, you're using small number of embryos. Let us say you had 2 embryos, statistically you should get maybe 1 out of 3. If you only had 2 embryos, if none of them become high-grade, so it could be due to egg and sperm or both, but here it just the quantity was so low and likelihood of failed embryo development is high. Likelihood of failed embryo development goes down as you get more eggs and more embryos.
Thank you so much, Dr. Rusty. That question was my final question for the live, but we do have a comment from a user, Zoe. Zoe has asked, would embryos still develop if they are genetically abnormal?
Yes, yes. So embryos, okay, so essentially how human fertility ensures that you have a healthy babies is you just keep deselecting unhealthy eggs and sperm and embryos in different stages of development. So if embryos have a lot of chromosome problems, they can grow maybe for a few days. They can be 8 cells, 10 cells, then they can stop. If they have less problems, they can become blastocyst embryos, then they can stop development. They can degenerate, they can become grade 4 embryos, which we don't transfer, or they can become even grade 3, grade 2, grade 1 embryos we transfer, they do not implant, which means they got deselected because they looked very healthy, but they didn't have a full capacity. So then in the past, we thought if you do PGT testing, you can tell. Now we know PGT testing can give you a wrong result. Why? Because embryos can keep healthy cells to themselves, like babies, and discard abnormal cells to the placenta, where you can take a biopsy and you assume this embryo is abnormal. Or you can take a biopsy from the normal cells if it's mosaic and you assume this embryo is normal. Actually, a lot of cells may be abnormal. So PGT is not answer for that. So essentially, you should really replicate what nature does. So these embryos naturally keep coming to the uterus, and a lot of them do not implant. Some of them implant. Unfortunately, you can have a biochemical pregnancy if they're almost perfect, not perfect. If they're even more perfect, but not fully perfect, then you can have a miscarriages. So this miscarriage is also nature's way of deselecting unhealthy embryos. Even they can become fetus and then they stop. So in 3 conditions, normally these embryos can keep growing. 3 chromosomal conditions. This is chromosome 21, 18, and 13 abnormality, like Down syndrome, Edwards syndrome, and Paget syndrome. In these syndromes, the embryos are almost perfect, and they have a capacity to keep developing, and and pregnancy can continue. And all the chromosome abnormalities, like not 13, not 18, not 21 chromosome abnormalities, normally the embryos stop developing. They can stop at any point. And these embryos we see under the microscope when we do IVF. So a lot of these embryos, they stop, they have got different type of abnormalities. That is actually, unfortunately, normal in human embryo development. And all the time happens naturally, simply we do not see them. And this is why we don't get concerned. This, when couples try to conceive naturally, this is always happening. These embryos stopping and in the fallopian tubes in day 2, day 4, 8 cell, 10 cell, morula, blastocysts. So simply what we see in IVF, it happens naturally in across maybe whole year. What we see in 1 month, it happens naturally across a whole year. So yes, embryos can stop developing, and they or if they have a chromosome abnormality, yes, embryos can keep growing this chromosome abnormality too.
Thank you so much, Dr. Rusty. That does conclude our live this evening covering embryo development. As always, the recording of this live will be published to Dr. Rusty's social media on TikTok and on Instagram. If you're interested in learning about day 3 embryo transfer, that will be the topic of our live tomorrow evening. So as always, thanks so much for jumping on, and thanks again, Dr. Rusty.
Thanks, Gabby, for organizing the live stream. Thanks, everyone, for joining the live stream. So, so we're meeting tomorrow, yeah? So tomorrow.
Yes, okay. Tomorrow we'll be covering day 3 embryo transfer.
Excellent. Thank you. Thanks very much.
Amazing. Thanks, everyone. Bye.
Thank you. Thank you.